The prevalence of tobacco smoking in Ireland has dropped from 23% in 2015 to 16.1% in the first half of 2021. This means that 83.9% of people in Ireland are currently non-smokers. Of the 16.1% who do smoke, 18.2% are males and 13.9% are females. This infographic also highlights the percentage of people in the different age groups who currently smoke one or more cigarettes per week. The Tobacco Free Ireland Policy Priority Programme was established in late 2016. Its remit is to mobilise the health service to improve health and well-being and play its part in the achievement of a reduction in smoking prevalence to less than 5% of the population by 2025. The objectives of the Tobacco Free Ireland policy programme are to prioritise the protection of children in all of our initiatives and contribute to denormalisation of tobacco use for the next generation, to support people to quit and treat tobacco dependence as a healthcare issue, and to monitor, build and maintain compliance with tobacco legislation. Considerable progress has been made to date in implementing the Action Plan for a Tobacco-Free Ireland, including smoke-free zones in public areas, raising the prices of tobacco products, completion of legislation to provide for standardised packaging of tobacco products, the provision of tobacco-free campuses and workshops across the country, proactive involvement of the NGO sector in supporting Tobacco-Free Ireland actions, legislation to prohibit smoking within the campuses of primary and secondary schools and childcare facilities have been introduced. The promotion of tobacco-free campuses and the denormalisation of tobacco, particularly in settings where children are present. Healthcare facilities throughout the country, especially hospitals and primary care facilities, are now tobacco-free. Great progress has been made at many third-level education institutions with the introduction of smokeless and smoke-free campuses, with more centres working towards its implementation. As a nation, we have made huge progress towards becoming a tobacco-free Ireland by 2025. However, there is still a lot more work to do, and reducing smoking rates less than 5% by 2025 is an ambitious goal. In 2019, there were approximately 165,000 fewer smokers than in 2015, and 46% of those who smoked in the past 12 months had made an attempt to quit. 67% had reported health concerns being the prime motivator for their attempts to quit. While much progress has been made, tobacco use is still the leading cause of preventable death in Ireland, with 5,800 smokers dying each year from tobacco-related illnesses. Cigarettes contain over 7,000 toxic chemicals, many of which are proven to cause cancer. Smoking harms nearly every organ of the body, causing many different illnesses and diseases. Smoking-related deaths in Ireland are mainly due to cancers, chronic obstructive pulmonary disease and heart disease. Cancers account for 44% of the disease burden, circulatory diseases for 30%, respiratory diseases account for 25%, and digestive diseases for 1%. Being smoke-free can help to prevent 15 different types of cancers, as shown nicely here in the diagram on the left. Smokers are more likely to get cancer than non-smokers, and this is particularly true of lung cancer, throat cancer and mouth cancer, which hardly ever affects non-smokers. The link between smoking and lung cancer is clear. 90% of lung cancer cases are due to smoking. 1 in 10 moderate smokers and almost 1 in 5 heavy smokers will die of lung cancer. The more cigarettes a person smokes in a day and the longer they have smoked, the higher the risk of lung cancer. Similarly, The risk rises the deeper a person inhales and the earlier in life they start smoking. For ex-smokers, it takes approximately 15 years before the risk of lung cancer drops to the same as that of a non-smoker. And for smokers, the risk of contracting mouth cancer is also 4 times higher than that of a non-smoker. Cancer can start in many areas of the mouth, with the most common being on or underneath the tongue or on the lips. So let's now look at the benefits of stopping smoking. After 20 minutes, blood pressure and pulse rate returns to normal and circulation improves in a person's hands and feet. After 8 hours, oxygen levels in the blood return to normal and the chances of heart attack start to fall. After 24 hours, poisonous carbon monoxide gas is eliminated from the body and the lungs start to clear out mucus and other debris. After 48 hours, nicotine is no longer detectable in the body and the sense of taste and smell improves. After 72 hours, breathing becomes easier as the bronchial tubes relax and energy levels increase. After 2 weeks, the circulation improves and walking and exercise is easier. After 3 to 9 months, coughing, shortness of breath, and wheezing are reduced dramatically. After 5 years, the risk of heart attack falls to that of a non-smoker, and after 10 years, the risk of lung cancer falls to about half that of a smoker. Life expectancy is only slightly less than those who have never smoked if an individual stops smoking before the age of 35, and stopping smoking before the age of 50 decreases the risk of dying from smoking-related diseases by 50%. The social and economic costs of smoking is substantial and places a huge burden on individuals, the healthcare sector, and the wider economy. Tobacco-related morbidity and mortality accounts for over 200,000 hospital episodes annually, with the total cost to the health service estimated to be 460 million. The total estimated cost of lost productivity is over 1 billion. The HSE Quit team provides a support service managed by trained smoking cessation counsellors. The service includes a team of advisors available over the phone, text, email, live web chat, or via Twitter or Facebook. The Quit service is evidence-based and can offer smokers a standard treatment programme where they will be tracked and supported for 12 months. The aim is to make people aware of the ill effects that smoking has on health and provide smokers with the encouragement and help they need to quit. If you want to stop smoking, getting the right help and support can double your chances of success. Call the HSE Quit team on free phone 1-800 201 203 for more details. As well as the tailored support when you sign up to a quit plan, you can also get help to quit through one-to-one stop smoking clinics, group support sessions, nicotine replacement therapy such as patches or gum, which helps reduce cravings and withdrawal, and prescription treatments are also available from your GP. You can get medication on prescription to help you stop smoking. It can double or triple your chances of quitting successfully. Your GP will help you decide which prescription medication is best for you. Interventions such as pharmacotherapy and behavioural change models increase smoking cessation. The use of visual, behavioural change and motivational aids such as the smokealizers shown here in the upper right, which is a non-invasive measure of blood carboxyhemoglobin, and the stages of change model can greatly support participants and enhance successful outcomes. Non-nicotine pharmacotherapy is clinically proven to stop smoking and has a good success rate. Smoking cessation interventions promote the Department of Health's Tobacco-Free Ireland by 2025 policy under the Healthy Ireland framework and empowers individuals to take a level of responsibility and control over one of the modifiable determinants of their health. Thank you for watching and listening.